Good morning, everybody. How you doing?
Good morning.
How about those Ravens?
Oh.
I had to get that out of my system. Good morning. My name is Joe Jones. I'm founder and CEO of Center for Urban Families, and I'm delighted to welcome you to today's event at our headquarters, which we affectionately call the Castle on Monroe Street. Our mission is to strengthen urban communities by helping fathers and families achieve stability and economic success. Our mantra is to dismantle poverty. Our work and impact includes strategic blend of direct services, advocacy, training and technical assistance, and a unique research and evaluation partnership with the Johns Hopkins Bloomberg School of Public Health. As a long-term partner of the Cash Campaign of Maryland's Volunteer Income Tax Assistance Program, we're excited to host today's event. Today, we're here to promote the state's Easy Enrollment Program, which makes it easy for Marylanders to sign up for affordable health insurance. Our building and this room are no strangers to big moments in efforts to support the interests of individuals and families to become economically independent. Throughout the year, city residents 18 and above participate in our Strive Job Training Initiative and Baltimore Responsible Fatherhood Program. In May 2013, we hosted President Obama in this room with Strive graduates and our employer partners. And we're also fortunate that we had then Representative Van Hollen to be with us during that time as well, for a discussion about how to create more ladders of opportunity for those most in need of economic supports. Affordable health insurance is an essential pillar of economic independence, and the Center is honored to host today's event and obligated to join with others in the fight to dismantle poverty. It is now my honor and privilege to introduce you to Vinnie DeMarco, President of Maryland Healthcare for All, who will MC the event, another one of Maryland's People's Champions.
Thank you, Joe. Let's have a big hand for Joe Jones and the Center for Urban Families. It's a really wonderful organization. Thank you all for being here. We thank members of the media, WJZ, BAL are here. Other members of the media are on live stream. And the media is important because we have a message for the people of Maryland today. You are lucky to be in Maryland. You are lucky to be in Maryland. We have wonderful Governor Westmore and our terrific General Assembly led by the new Speaker, Jocelyn Pena-Melnick, and President Bill Ferguson, and other leaders of the General Assembly. You hear from Bonnie Cullison in a couple minutes. Maryland has done everything we can to protect Marylanders from attacks coming from the federal government. You'll be hearing a lot about those protections today, but I want to emphasize it. You're lucky to be in Maryland, and one of the protections is the terrific Easy Enrollment Program, which we enacted in 2019 and is being implemented and allows you to sign up at tax time for health care. We are today announcing a $100,000 media campaign to urge Marylanders, if you're uninsured and you missed open enrollment or you're eligible for Medicaid, check the box at tax time and you could get enrolled. Tens of thousands of Marylanders have used that, and it's especially important now. We're going to hear from wonderful people who are going to talk to you more about this program, but I want to first recognize our members of our team who are here. Reverend Sandra Connor, the first woman president of the Night Ministers Conference of Baltimore City. Jesse Ablin are here. And I want to thank our sponsors who are making our ads possible. And we have some representatives of our sponsors here. They're all listed there, but I want to recognize Nikki Highsmith-Vernick from the Horizon Foundation. Where's Nikki? Thank you for being here. Jen Whitten from LifeBridge Health is here. And Will Tilburg, where is here? Will Tilburg from the University of Maryland. And Andrew Nicholas from the Maryland Hospital Association. Thank you, Paul Spurgeon. We have our other sponsors. Any other sponsors here that I missed when you came in? Thank you. And these ads are so, and if you look over here, if you can move for just 1 second, here you can see the billboards that are up all across Baltimore City now, urging people to check the box at tax time. We also have social media, and we have radio ads featuring Joe Jones, Comptroller Brooke Learman, and Michelle Everly from the Exchange. So we're out there with this message that you're lucky to be in Maryland, and check the box if you're uninsured for health care. It's my great honor now to talk to you a little bit, my all-time hero. And I just want to tell you one little story about Chris Van Hollen. In 1999, some of you may not have been born, but in 1999, I was working with then State Senator Chris Van Hollen to pass the first major tobacco tax in a long time in Maryland, which really reduced teen smoking and funded health care in our state. And he was told at the time by the leader of the Senate, "This will pass only over my dead body." And Senator Van Hollen said, "I guess that's the way we have to do it." And he did it. And nothing stops him from accomplishing what he wants to accomplish. And I was sorry to have him lead the state Senate, but I'm thrilled that he is now one of our top public health leaders in the United States Senate, making things happen. Let's hear it for Senator Chris Van Hollen.
Well, thank you, Vinny, and I do want to start by saying Happy New Year to everybody other than the Ravens boss. And Joe, thank you for your leadership, long-time leadership in trying to end poverty in Baltimore City and Maryland, which is something we should also strive for across the country. And I want to thank you and Vinny DeMarco for teaming up here. Reverend Connor, it's great to see you. Thank you for your leadership and others.
Thank you.
But to Vinny DeMarco, who many years ago launched the Health Care for All campaign, meaning every single Marylander should have affordable health care. Thank you for your tenacity, your persistence, and progress that we've made as a result of that, along with the team that has been focused on this. And I do just want to thank others who are here today. I want to thank Comptroller Learman, who has really been focused on making sure we administer and check the box, alongside her many other duties in the Comptroller's office, where she's been a great leader on all sorts of things. Of course, to the Governor and the Governor's team represented here today, who are also focused on making sure that Maryland leads the way when it comes to affordable health care. And of course, to Bonnie Cullison and all the members of the Maryland General Assembly. They're the ones that originally passed the easy enrollment law. So thank you all as you embark very shortly on your next session of the General Assembly. And of course, to Zeke Cohen and members of Baltimore City, elected leaders here, the mayor, because they're doing everything they can as a city to make sure that we enroll. And of course, Michelle and Team Maryland, thank you for your longtime efforts here and the cash campaign and others. I do think it's important to recognize that this is a team effort, a Team Maryland effort. And I want to amplify the point that Vinny DeMarco made about Maryland, because the group that you see here is doing everything they can to help protect Marylanders, and specifically for today's purposes, protect affordable health care in Maryland, despite the incredible headwinds that we're facing from the Trump administration and a Republican majority in Congress. And that is a statement of fact. It's not a partisan statement. All you have to do is look at the votes right now and the statements in the United States Congress, because what Maryland has done is move forward with an easy enrollment approach. In other words, Maryland wants more people to have access to affordable health insurance. And I want to thank all of them. My understanding is, as a result of this effort, you have seen about 160,000 Marylanders use that check-the-box method to learn about their health care options, and at least about 19,000 have signed up using that vehicle. And so when Vinny DeMarco and Joe talk about January 15th, for anybody out there who is still wondering whether or not they can access the Affordable Care Act benefits, please go online, go to the Maryland Exchange, and sign up. Now, I do want to talk about the headwinds we're facing at the federal level, because they're very real, and they are harming Marylanders as well as other Americans. When President Trump and the Republican majority in Congress passed what they called the Big Beautiful Bill, which is beautiful if you're a billionaire, but really stinks for everybody else. They made dramatic, cuts to Medicaid, and the clock is ticking on those. They very cynically made it so that those cuts would not actually take full effect until November of this year, after the 2026 election, but they're going to be very harmful. The other thing they did was extend permanently tax cuts for billionaires and very rich people. But they allowed to lapse the one tax credit that benefits working families, middle-class families in America, and helps them better afford their health insurance. Those are the Affordable Care Act tax credits. And because they rolled those back, because they allowed them to die at midnight on December 31st, as a result, 20 million Americans will no longer get the benefit of that tax credit. They'll see their premiums go through the roof. And it's estimated that 4 million of those Americans will no longer be able to afford health insurance, even when they stretch every penny. And so they will be uninsured entirely. In Maryland, the figures are 190,000 Marylanders benefit from that premium tax credit, so they will see their insurance costs go through the roof, and 30,000 of them are estimated to lose their health insurance entirely because they cannot afford it. And we all know what happens when you can't afford your health insurance. You go to the hospital. Hospitals rightly will care for people. It becomes uncompensated care, which is paid for by everybody else. So everybody's health care costs go up. That is the consequence of what the Trump administration and the Republicans in Congress have done. I'm working with the delegation from Maryland, Senator Alsobrooks, 7 of the 8 of our Maryland members of Congress are working to reverse that lapse in the tax credits. In the House of Representatives, they filed what's called a discharge petition to require the whole House to vote on extending those tax credits. The proposal would be for another 3 years. And when that gets out of the House, we're pushing the Senate Republican leadership to take it up and vote on it. At the federal level, we're also working to implement what Maryland has done. In other words, a national easy enrollment plan, and work very closely with Vinny and Joe and others to design that package so that everybody in America, when they get their federal tax returns, can check the box, just like you can do in Maryland, and sign up. And as a result of that, millions more Americans who are eligible but don't know about it will be able to sign up for affordable health insurance. So those are the 2 things we're working on right now to try to make sure that we, number one, undo the damage done by getting rid of the ACA tax credits, but also expand coverage across the country. But I just want to end really where I started, which is to thank all these Marylanders, including the Cash Campaign and others who've been very focused on trying to make sure that Marylanders are taken care of, even at this time when federal national policies driven by the Trump administration are trying to move us backwards. So thank you, Team Maryland, for working to move us forward, even under very difficult circumstances, and we'll keep working with you.
I'm glad you mentioned your wonderful colleague, Senator Angela Alsobrooks, another hero of ours, and thanks, Paxton, for being here on behalf of Senator Alsobrooks. Let's have a hand for Senator Alsobrooks. Thank you. I also want to recognize Vicki Schultz, the head of legal aid in Maryland. Thank you for being here. Before we go on to the other speakers, before you all leave here, anybody who's been to one of our press conferences knows we need you to all gather behind our banner over there for a big banner picture with everybody smiling. Next, I want to introduce one of my other heroes in Maryland who has done so much for us as a delegate and now as comptroller to make sure that Marylanders are protected. We have seen tremendous progress in the comptroller's office in Maryland and making it more up-to-date, more consumer-friendly, and she has been a tremendous supporter of the Easy Enrollment program to make it work. So let's hear for Comptroller Brooke Learman.
Such a pleasure to be here with everybody, and good morning, Happy New Year. I had a purple suit already. Settle for green. But I hope so many of you were able to celebrate with friends and loved ones last Wednesday to celebrate the start of the new year. One of the things that I was thinking about last Wednesday when I was with my family is that when the clock struck midnight on December 31st, as our fantastic U.S. Senator reminded us, thousands of Marylanders greeted the new year not with cheers, but with increased anxiety, with increased worry and concern at the prospect of going out without health insurance, because they are now facing higher health insurance premiums. Kaiser Family Foundation data explains that for a typical 60-year-old making around 400% of the federal poverty level, premiums in Maryland could jump $400 plus a month this month. Why? Well, as the senator explained, because congressional Republicans refuse to extend the tax credits that make healthcare affordable for so many working families here in Maryland and around the country. And I think it's important that we all remember that this is not abstract policy. This is about real people being forced to make impossible choices. Health insurance or food, health insurance or childcare. And we know in Maryland that we have to do better, right? Republicans at the federal level chose indifference, but in Maryland, we every day choose action. And as your comptroller, as the comptroller for Maryland, I am dedicated to working as part of this phenomenal team that you see here to make sure that we choose action for all Marylanders. I see the numbers every day, and here is what I know. Healthy Marylanders are productive Marylanders. When people can see a doctor, when they can get that preventative care, when they're not choosing between paying for medicine or paying for rent, our entire economy is stronger. I also know this. Too many families are struggling right now. Wages aren't keeping pace, costs continue to climb, and health insurance premiums are no exception. But I believe, and I think everybody here, refuses to accept that affordability is out of reach permanently. We know that we can do better. And in Maryland, we are doing better. As Vinny, our great leader, who gathered us all here today, said and reminded us, we are lucky to be in Maryland now. Because we are creative, thoughtful, and persistent. And that's what we're doing as we are here today. We are here to champion the Easy Enrollment Program, complete with premium assistance. This is an incredibly straightforward program. Marylanders file their state tax returns. They can check one box to get connected with affordable health insurance options. That's it, one box. I'm going to repeat it again. Here's how it works. Marylanders who want health insurance for 2026, including those who missed the January 15th open enrollment deadline, they simply, when they file their tax returns, need to check the box that say that they are interested in being connected with the Maryland Health Connection. The individuals that Michelle works with, her fantastic team, then follow up with information after my fantastic team transmits that information to her. So I'll give you a concrete example. A 30-year-old making $39,000 a year might have to pay $275 a month for health insurance. But now they checked the box, they got that information, but with Maryland premium assistance, that number, $275, could drop to $121. Real savings for real families. And this program helps Marylanders earning up to 400% of the poverty level. Marylanders can go visit marylandhealthconnection.gov to see if they qualify. So why does this matter so much? Because most Americans don't have $1,000 saved for an emergency. A sudden illness, an accident, an unexpected diagnosis, it can devastate a family's finances overnight. I've seen the challenge of needing health insurance unexpectedly up close. I'll say, when I was in college, I was all set to join the Peace Corps. I was accepted, and when I was working as a waitress, killing time before I left, I was diagnosed with severe arthritis, and almost overnight couldn't work anymore because my feet and my legs were so affected. My plans to join the Peace Corps went belly up. The medical appointments, procedures, bills, it all added up fast. But I was fortunate. I had health insurance. It covered the costs, and I was able to redirect my path toward public service in a new way, which led me here today. But not everybody has that option, and they should. No one should have to choose between their health and their financial security. So to every Marylander without health insurance, we are here to serve you and to help you. Check that box when you file your tax returns. Get enrolled. Learn more at marylandhealthconnection.gov and marylandtaxes.gov, marylandcomptroller.gov, all the websites. A healthier Maryland is a stronger Maryland. And a stronger Maryland is one where all residents, not just some, can afford the coverage they need to thrive. So I'm so honored to be here to work with this incredible team, this amazing building that Joe and his incredible team do a fantastic work in every day, building a stronger, thriving Baltimore. Thank you to all of you, and Vinny, back to you. Onward.
Thank you, Madam Comptroller. We love our comptroller. She's terrific. And ladies and gentlemen, we're lucky to be in Maryland. I want to repeat that. And one of the reasons is we have such a great General Assembly. And our new Speaker, Speaker Jocelyn Pena-Melnick, she is absolutely wonderful. And she was the lead sponsor in 2019 of the Easy Enrollment Law, first in the nation, along with Senator Brian Feldman. The two of them are great, but their progress was made possible by other legislators, particularly Vice Chair of the Health Committee, Bonnie Cullis from Montgomery County, who I can tell you on this issue, on prescription drug affordability, on anything, is the go-to person in the Maryland General Assembly on healthcare smarts. She knows more about it than anybody, and she knows how to get things done. So we love Bonnie Cullis.
Thank you, Vinny. You always leave me blushing. Thank you all for being here today and for talking about this very, very important program for Marylanders. You know, we're standing in an auspicious building here. This is a place that provides hope and opportunities. This is a place where the people who are often disenfranchised, overlooked, suffering from economic struggles can get a hand up so that they can reach their full potential, both personally and economically. I want to thank Mr. Jones, your staff, and the volunteers who work here at the Center for Urban Families for your commitment to others. One of the fundamental needs, as we've heard several people say so far, is to reaching that potential is good health, which is supported by good health care. Over the last 2 decades that I'm aware of, perhaps before that, the General Assembly has been committed to assuring that all Marylanders have access to affordable health care. We've put a number of first-in-the-nation programs in place so that we were able to decrease the number of uninsured in Maryland from 13% to 6% last year. Boy, would we like to hold on to that. But we're going to look to Senator Van Hollen and his colleagues to help us. And as Vinny just referenced, in 2019, now Speaker Pena-Melnick and Senator Feldman worked together with the Comptroller's Office and the Maryland Health Exchange to establish the Easy Enrollment Care Program. The bill passed on a widely bipartisan margin. It was a bipartisan victory for Marylanders. Now, I suspect that many of you in this room have had the experience of governmental red tape, delays, and processes that present barriers to your ultimate goal. Sometimes, I'll have to admit, government stands in its own way. In contrast, the Easy Enrollment Program was designed to use government processes to the absolute benefit of Marylanders. I am very proud of our Maryland Health Benefit Exchange and Marketplace. I get the opportunity to speak to representatives across the country, and I can only say it is one of the highest functioning quasi-governmental agencies in this nation, as far as I'm concerned. It is a true resource to our friends and neighbors, but not everybody knows about it. In order to implement the Easy Enrollment Program, it was the responsibility of the folks who work at the exchange to come up with the data safeguards around conveying information between agencies, because frankly, that was not done. And when given the information from the Comptroller's Office, as Comptroller Learman just alluded to, the exchange can quickly determine eligibility for free or reduced health care options, or help folks compare plans that will best meet their needs. You know, I tried to compare health insurance plans before I became the chair of the Insurance and Pharmaceutical Subcommittee, so this is a while ago. And I just got lost in the words. I couldn't figure it out. If I ever have to do that again, I'm going to a navigator. There's no question. With the Easy Enrollment Program, the taxpayers have an easy way to see if they are eligible for financial support and with selecting a program. The only red tape, and it hardly qualifies, is checking that box that the comptroller spoke about. And as we've said, in the 5 years of implementation, tens of thousands of people have taken advantage of it. In these times, we can't depend on the federal government to support the health and well-being of Marylanders. The state has to take on new responsibilities, both for the health of our people, but also for the health of our economy. Because as the comptroller said, when our residents are healthy, our economy thrives. Making sure that there is access to good health care is good for people and good for our state. So I want to thank Healthcare for All for its tireless advocacy for information and education about the options that are available to Marylanders, and this impressive campaign to get that information out. And I will say that I affectionately refer to Vinny as the Jiminy Cricket of healthcare in Maryland, and my colleagues in the House would agree with me. And I believe that I speak for my speak for my speaker and the colleagues in the House and the Senate, that we look forward to continuing our work with you to assure that all Marylanders have good health care. Thank you.
Thank you, Madam Vice Chair. And just so everybody knows, that drop from 13% to 6% uninsured resulted in $460 million less uncompensated hospital care. And that means less pressure on our premiums going up. We all benefit. I think Comptroller Learman taught me how to say this. We all do well when we all do well. I love that line. It's a great line by the Comptroller. And did I say this again earlier? We are lucky to be in Maryland. And we've got great federal officials, great state officials, and great local officials. And one of the very best is our own city council president here in Baltimore, Z. Cohen, who before he was city council president was a leader in gun violence reduction and so many other ways to make Maryland and Baltimore better. And he's doing a great job as city council president. We're thrilled to have him with us. Z. Cohen.
Yeah.
So let me first say thank you to Vinny. Jiminy Cricket works. I was going to say Vinny feels like my OG uncle. And then anytime we get a call from Vinny, you pick up your phone, you know he's going to ask you to do something. And you may not want to do it, but you know it's going to be good for people.
Right.
And that it's going to end with more people getting health insurance. So appreciate Vinny for his nudginess and all the things. Also, do want to take a quick moment to just thank Senator Van Hollen. There are not a ton of models of leadership in DC right now, and I would say that you, sir, are meeting this moment.
Yes.
I want to thank all of my friends and colleagues who are up here. And I also want to say this, which is, it is, Senator, a great time to be in Maryland. It's also a great time to be in Baltimore. And I say that in part because when the clock struck midnight and we entered the new year, we saw this year the least amount of homicides in our city's history since 1970 when we started counting. And I say that because here in Baltimore and in Maryland, we believe that public safety is public health, that they are inextricably linked. We believe, Joe, that anti-poverty work is public health. We believe that trauma-informed care, that acknowledging the things that people have been through that brought them to this place is public health. And we are blessed in the city of Baltimore and in the state of Maryland to have some of the best hospitals in the entire world concentrated in our city. We're blessed to have some of the great public health schools and organizations right here in the city of Baltimore. And we're blessed to have a team in our state, in our federal, in our local government, and I want to again acknowledge Mayor Scott doing a great job on the anti-violence work, that truly believes that healthcare is about more than just, did you go get your checkup?
Yep.
It is comprehensive, it is public health, it is all the different things. And I remember being a teacher, one of the cruel ironies about Baltimore is that we have some of the best hospitals in the world, and yet we have a lot of really sick people. We have profound disparities in who gets health care. And I know that's something that Joe and other folks have been working on. But I remember being a teacher, Joe, not too far from here in Sandtown, Winchester, in West Baltimore, and just being amazed how few people had health insurance, how few people got basic preventive health care or mental health care. With a population of folks that have seen disproportionate amount of diabetes, have seen disproportionate amounts of trauma and other mental health issues, the lack of health care in some of our communities is stark. And so it is a beautiful thing to be here with my colleagues for this easy enrollment program so that people can simply, as the comptroller said, check a box and then start getting health insurance. I remember Comptroller Learman and I, before she became comptroller, before I was council president, we represented Southeast Baltimore, where we have a high amount of immigrants, primarily from Central America, South America, but really all over the world. And it is a beautiful thing. It is, as opposed to, Senator, the president's rhetoric about our immigrant community, it is one of the reasons why Baltimore is thriving, is we have this vibrant, diverse population of people, but again, profound healthcare disparities. Not enough people with basic health insurance. And so it is a blessing, Vinny and Brooke and Chris and Joe and everybody and Bonnie, to be here with you all in this moment where Maryland is bucking the trend, as opposed to a federal government that literally is kicking people off their health insurance, off their food stamps, off of basic benefits that we have considered to be part of the social contract. Here in Maryland, we're going the opposite direction. And here in Baltimore, we always want to go even one step further. So it is just an honor to be here with you all. Thank you for, Vinny, your leadership. Thank you for always pulling together a fantastic coalition of people. That I feel like is the other special sauce that Vinny has. It's like you always get the right amalgam of folks in the room, which is a real skill. Thank you to Suzanne and the entire team that's here, and Reverend. Thank you to everybody, and I'm just excited for this moment, for our city, for our state, and for Baltimore and Maryland to continue to keep winning. Thank you.
Thank you, Mr. President. Thank you very much. And I said earlier how much we love our Governor Wes Moore for his leadership. And one of the signs of his leadership is the great people he picked, including a terrific Secretary of Health. And she is a great person. One of the reasons is she picks great people, including the wonderful Deputy Secretary Perry Briskin, who's with us, who's going to talk about the importance of easy enrollment to Medicaid. Most of the people who sign up for easy enrollment are Medicaid, and we love our health department and the Medicaid department. They're doing a great job. Perry?
Hi everyone, thank you so much, and thank you to Vinny for organizing this incredible event. I think Zeke said it best: when Vinny calls, I pick up, and I do what he tells me to do, and that's been my biggest lesson since joining as the Maryland Medicaid Director. Maryland Medicaid covers over 1.4 million Marylanders, almost 1 in 5 individuals in the state, almost 1 in 2 children in the state. We are a critical pillar of the healthcare system. We pay over 120,000 providers in the state. So for the healthcare system to work in Maryland, you need a strong Medicaid program. And we are so committed to that. And even against the headwinds that the Senator mentioned, we are committed to making sure that people have access access, access, access. And part of that access is the easy enrollment box to give people the easiest way to get information about their health care. And then as we go into 2026 and 2027 and some of these enormous, unfortunate changes that Medicaid is facing, we are keeping access paramount. Can people enroll in coverage? Can people keep their coverage? Can people access providers to give them that coverage? So that is what we and my team in the Maryland Department of Health and Secretary Mina Seshamani is focused on every single day. And we are continuing to work with our partners, Michelle Everly at the Maryland Health Connection, to make sure that we make that even easier for people in Maryland and continue to do so. So we are so proud to be partners with easy enrollment and the checkbox, and then to do more and more that we can to support the senator in making sure that we keep as many Marylanders covered as possible and give them access to the health care they need to thrive, to work, to go to school, to raise healthy families, and we are so, so proud of that. So thank you, Vinny, thank you everyone here, and please continue to support your Medicaid program.
Thank you, Terry. We are lucky to be in Maryland with public officials like Terry Briskin. And you've heard a lot about the Easy Enrollment Program. Let's talk about how it works. One of the key people making it work is the CASH campaign. You heard Joe mentioned it. They have an office down the hall here where they actually sign people up and encourage them to check the box. So we are thrilled to have with us Sarah Johnson from the CASH campaign to talk about how this works.
Happy New Year. Happy almost tax season. Yeah. Right, Comptroller? We're excited. We're excited.
Excited to get people their refunds.
Exactly. I'm really very thrilled and honored to be here. Thank you everyone for welcoming me and having CASH be part of this wonderful event. It is indeed a team sport, and Maryland is indeed an amazing place to be and to do work to help our fellow Marylanders. My name is Sarah, and I'm the co-founder and COO of the CASH Campaign of Maryland. For anyone who doesn't know, CASH stands for Creating Assets, Savings, and Hope, and we are kicking off our 25th tax season in just a couple weeks. Hard to believe here in Baltimore, and I'm really pleased to say that Joe's team here at CFUF has been a longtime partner, and we are looking forward to another successful year to serve people in Maryland. We're an IRS certified program. There are many of us around the state. We help lead the work here in Maryland. We have partners in 19 counties across the state, so we didn't just make this up overnight. We've been doing this work a while in partnership with our federal agency, and this year we'll be serving families who made $69,000 or less last year. So you can make appointments. They'll be opening up in a couple weeks to be able to make your tax appointment, and it's all free. So if you are eligible, please come to one of our free tax preparation sites. You'll save money there, but also we have almost 1,000 volunteers across the state who are trained and certified to help prepare taxes and file them. And they're also trained on how to talk to people about checking the box, right? So we are spreading the good news through community agencies, through state agencies, through church basements. We have staff and volunteers around the state that are also spreading this good news. So I know we've got media here, which is important, but also know that your word to go out in the community and let people know. File your taxes for free, save that money, get your tax credits, please, with the CASH campaign, and then make sure you check the box and take advantage of other opportunities. I'll just say what we've learned in working with families that come through the doors like here at CFUF is that they're nervous when they come in. They're worried. They've got their documents. Sometimes they're a little, in a plastic bag marching in, Baltimore briefcase we call it, affectionately. And we try to make sure we help explain these processes to them. And so checking the box and integrating that box right on the tax form works. It simplifies the process for people, and it helps people feel more relaxed and able to take charge of the opportunities that are in front of them. So I applaud Maryland for the work that they're doing, and I hope that this model is able to spread so that other states can learn from the great work happening here. Thank you again, Senator Van Hollen, for your work, and DC, we really need you out there. Thank you very much. And Vinny, thank you so much.
Thank you. And we are lucky to be in Maryland because, as Senator Van Hollen said, we have the best health benefit exchange in the country, bar none. And we say that to all our colleagues across the country, and their team is just wonderful, and they're led by a terrific woman who's doing a great job implementing not only easy enrollment, but protecting Maryland from the tax credit debacle and everything else. So we love Michelle Everett.
text for the day. Where are we lucky to be? And I'll give you a little bit of behind the scenes in that. I get texts often from Senator Van Hollen's office saying, can you get us this data? Can you send us this? We're working on this. Can you get us this? They are right on top of everything, and they are getting the real live data that is needed to help make our case in Washington. Vinny, as we all know, texts everybody. We all might look and say, oh, Vinny. And I get texts from Delegate Cullison frequently. Can you get us this? Can you do that? And of course, we have direct lines to the Comptroller's office, to the cash campaign, daily with MDH. So we are so connected as a team here, what you've heard, and that's a little bit behind the scenes. So making it easier for Marylanders to get health coverage has been a top priority for the exchange since the Affordable Care Act became law in 2010. Back in 2018, I'll give you a little bit of history, we're asking ourselves an important question. How do we get more Marylanders insured without forcing them through a state mandate? Many other states have implemented, if you don't have health insurance, you're gonna pay. We didn't want to take that approach. So we believe then, and we still believe today, that when people have access to affordable health coverage, they want to keep it. You don't have to force people to do the right thing. You just have to make it possible and easy for them. So in 2019, with the help of those around me here today, Maryland took a bold and innovative step. We passed legislation allowing residents to simply check that box on their state income tax return. That one small action allows their information, as you've heard, to be securely shared with the exchange, and so we can promptly help them enroll in health coverage that's right for their family. The results speak for themselves. Since that time, over 19,000 Marylanders have gained health insurance by the checkbook box. But we didn't stop there. Building on that success, we launched the Unemployment Easy Enrollment, which has helped tens of thousands more Marylanders access health insurance during some of the most challenging moments of their lives. And this year, sadly, we saw a lot of federal employees who needed that coverage. And here's what we know for sure. Marylanders still want affordable health coverage. We are now in the final stretch of the 2026 open enrollment period, just 10 days left, and I'm pleased to report that enrollment has already surpassed last year's total, with more than 249 Marylanders enrolled as of today.
249,000.
249,000. What did I say? Oh, no. Now, that sounds really good, but let me give you the rest of the story. First, that success reflects thoughtful state actions that we took earlier in the year to prevent premiums from skyrocketing through the State of Premium Assistance Program. More than 36,000 of our enrollees, as of yesterday when I checked, are new to the exchange this year. What we're seeing is a lot of younger people coming in, and that's where the state premium assistance had the most impact, those age 18 to 37, which is great for the whole risk pool. At the same time, nearly 23,000 individuals have terminated coverage. You heard Senator Van Hollen say we had estimated 30,000. We're not done yet. We won't know until April what the bottom line will look like. But as of this moment, 23,000 individuals. We know some of those are immigrants that are deemed no longer lawfully present. And we know that particularly what we're seeing is those age 55 to 64, pre-retirees, many over a 400% federal poverty level, which for a family of four is $128,000 in Baltimore. They are either buying down in coverage, so going from a really good rich benefit plan of a gold down to a bronze, taking on more financial liability, or just dropping their coverage. Now, we know while not all those losses are tied to Congress's failure to extend the expanded tax credits, we know that many of them have and are for that reason, and that matters. And one thing I want to stress, which Senator Van Hollen, I believe, said, these are taxes that have been withdrawn from working families' paychecks that those families are using to do the right thing and buy health insurance for their family. So while the One Big Beautiful Bill Act gave lots of tax credits for very wealthy people, working families that just want to use taxes they've paid into the system to help them buy health insurance has been taken away. Essentially, they've had a tax increase. So as we head into the next tax season, we will continue doing what we do best, which is improving the health and well-being of Marylanders by making health coverage easier to access through smart, innovative programs like the Tax Time Easy Enrollment Program. Can't do it without our partners here. The cash campaign is vital, the Controller's Office is vital, and we'll continue to do that. So please remember, if you or someone you know needs health insurance, you have through the 15th to get it through the open enrollment period. If you miss that deadline, and that's for February 1st coverage, even if you don't think you're eligible at any point during the year, but particularly during tax time where you can just check that box, make it really easy. But even after that, if you're unsure, just go to marylandhealthconnection.gov, call us. We are here to help. We are here to help you through the Tax Time Easy Enrollment Program. We know it works. We are advocates for its expansion nationally, and we hope that Senator Van Hollen will get that across for the rest of the nation. And thank you, Vinny, for assembling us all here today.
Remember, ladies and gentlemen, we are lucky to be in Maryland. And I think that's, any questions? Brooke, you want to stay for the picture? I gotta go. Oh, all right. And questions, Dave?
Yes, thank you. I have a question for the Senator.
Let's hear it for Comptroller Learman. Senator.
You're planning, or you are trying to expand easy enrollment as a national. 9 states currently have what Maryland has. If, suppose a state doesn't have a health connection like Maryland, how would that work?
So all states have access to exchanges, whether they're the state exchanges or a federal exchange. So the idea would be on your federal income tax form, you do exactly what you can now do in Maryland. And just as the process works in Maryland to connect people, you would either connect them directly to the state exchange, or you'd have to do it through at the national level. But either way, it would make sure that millions of Americans who are eligible for the Affordable Care Act but don't know it would have that access.
We hope that gets passed.
Yes, we introduced it in June, and we're going to keep pushing. I will say that there have been organizations in Washington that, if you look at them ideologically, they do span from sort of more liberal to more conservative, have endorsed the idea, because the idea, as was indicated, is simply to make government more efficient in order to advance people's access to health care that they already are eligible to receive.
And as Michelle said, the Easy Enrollment Bill in Maryland was quite bipartisan, overwhelming support. Other questions for
I have one more. As far as Maryland is concerned, you have eligibility, and eligibility changes. Is there a proposed legislation to expand the eligibility, or is it going to stay the way it is right now?
You want to take that?
To my knowledge, there's no legislation being considered to expand it. We're trying to keep those who are currently receiving benefits from suffering, a cliff, going off a cliff. And so we've got to, combine this interest and commitment with the needs that we have budgetarily. So right now, I think that's where our focus is. Ultimately, when in better times, we definitely hope to expand.
I do want to commend the General Assembly and the Governor and others, because they put in place some provisions that would trigger in the event that the Congress did not pass the extension of the Affordable Care Act. And of course, as we discussed, the Trump administration, Congress did not do so. And Maryland has cushioned that blow a little bit with state resources. So I want to commend you for that. In other words, people will still get hit, but they won't get hit as hard as they would otherwise be.
Is that all? Okay.
So I'm a new Marylander. My name is Michael. I'm also a D&T student at Hopkins University. I actually made my first policy brief on this exact bill, and one of the most common questions I had from the Bloomberg School of Health and professors were, what's the traction going to look like? Like, what are going to be the implications to data privacy with federalizing this? What are the implications to structuring the data? Who's going to be overseeing it? I kind of just want to understand, what's that like next step going to look like if this bill were to pass and federalize?
Well, the next step would be to create the coordination, right, between the federal, the IRS, but also the state, whether it's the comptroller's office or others. The idea is to, again, do federally what they've done in Maryland. Obviously, that requires a few additional steps, but I'm happy to follow up more with you directly in terms of the details.
Okay, thank you all very much. Jesse, could you get our banner? We're going to line up right here. And other folks in the audience, welcome to come up, especially our sponsors. And we're going to all line up behind this banner that I'm going to have here in a second.